Hello, welcome to Sonography-radiology training channel. In this series of videos, a case with one teaching point is presented. This is the 9th video in this video series about pectoral muscle hematoma. A 61-year-old woman underwent physiotherapy following a stroke and paralysis of the left side of her body. She was receiving anticoagulant therapy. After physiotherapy, she had a sudden swelling in the left side of her chest and was referred for breast ultrasound. In left breast ultrasound, there is no any finding in breast tissue, but we found a thin-walled cystic lesion with fine internal echoes in pectoral muscle. And as you can see in color Doppler ultrasound, there is no any vascularity in the lesion. For better definition, you can see here per-mammary layer including subcutaneous fat layer, here is mammary layer, and here is retromammary layer including pectoral muscle and ribs. We encountered with a pectoral muscle cystic lesion suggestive of pectoral muscle hematoma. The differential diagnosis of a bulging pectoral swelling includes subpectoral abscess, pectoral major tendon rupture, post-pectoral implant procedures, post-pacemaker implantation, and pectoral muscle hematoma. Trauma to the chest wall or invasive medical procedures of the thorax are generally the cause of pectoral muscle hematomas, which is a rare condition. Occasionally, there may be no history of trauma or invasive medical procedure, with hematoma occurring spontaneously. Anticoagulant therapy can be the underlying etiological agent. Acute development of swelling in the anterolateral chest wall may be indicative of pectoral muscle hematoma. Ultrasonography and CT are commonly used methods of definitive diagnosis. But here, please pay attention to this teaching point. Spontaneous pectoral muscle hematoma should be considered in the presence of clinical suspicion in older adults taking anticoagulant therapy. Bleeding may be severe, so follow-up and replacement of fluids and blood is critical and can be life-saving. Thank you for your attention.